our body is filled with cells. These cells need energy, they get it from sugar. They get the sugar from our bloodstream. It sends a message to the liver, I need more sugar. We send the blood the sugar. The problem is for the sugar to get in the cell, it has to have insulin. Insulin opens the door to let the sugar in. If you don't have enough insulin, the cell is hungry and saying, send me more food. The liver keeps producing more sugar. The blood sugar goes up, but it's as if you're trying to fill your gas tank, but the filter is clogged, so the engine is saying I need fuel, but all you're doing is getting this overflow of fuel. You're getting this overflow of sugar. Part of it is we're eating refined foods, which have quicker conversion to sugar. We have higher concentration sugars, so we're basically overloading our body with sugar. And then lastly, sometimes there's just too much for us. We can produce enough insulin for a 150-pound person. We can't produce enough insulin for a 250-pound person. So the more of you there is, the less insulin per cell, and without the insulin, you're starving your body.
As an ophthalmologist, for me, it's important to look at my patients with diabetes and diagnose diabetic eye disease early. Diabetes might affect the lens of the eye, and then patients develop cataracts earlier than average. Diabetes can affect the back of the eye or the retina, and then patients can lose vision. At the same time, diabetes can lead to glaucoma, so there are quite a few eye disorders connected to diabetes. The signs and symptoms of diabetic eye disease range from being completely asymptomatic, meaning no symptoms whatsoever, to decreased vision, to losing vision entirely. Therefore, it's extremely important for patients with diabetes to get an eye exam every 6 months.
So the first rule is being able to test sugars, which now is very simple. We have little meters and they're very compact, easy to keep. The second issue is eating smaller meals, eating better balanced meals, dividing it through the day so you don't get a major sugar rush. And then of course, looking for how to add those steps to your day. Using an elevator all the time may not be your best friend. If you only have to go a floor or two, use the stairs. Don't park in the closest possible parking space. Look for the opportunity to do what you need to do, which is exercise, eat right, and it's also very, very important that you stay hydrated.